Measles cases have surged worldwide this year amid disruption caused by COVID-19. The UN has warned that the increase suggests outbreaks of other diseases are likely to be on the way. Who better to talk to about this? Well, let me show you a couple of graphics. 79% in the first 2 months of the year compared to the year before. As I was saying, Dr. David Nabarro is with us now, the WHO Special Envoy for the global COVID-19 response. And in addition to that, obviously, you've got a view on what's happening as far as the measles are concerned, Doctor.
Yes,
I know that you have young people in the family, don't you? How concerned should we be?
Well, you know, modern life is about using modern science to keep ourselves healthy and safe. And vaccination against the common illnesses of childhood is one of the absolute basics of modern life. And we've got really good vaccination programs all over Europe to keep kids safe. One of them is the vaccination program against measles, but it's been slowed down because COVID has really taken up so much of healthcare. And so we've got an awful lot of people who've missed out on measles vaccination, 73 million throughout the world. And that's meant that this year, in the first few months, there have been 17,000 cases of measles globally, whereas in the first 2 months of the previous years, it's usually been lower, 10,000 or less. So yes, we've got a global measles epidemic, and that worries us because measles can be a very dangerous disease. We just got to get the vaccinations working again, and that's part of getting health services working again as COVID settles into a more regular position in our lives.
OK, so what do we need to do as parents, grandparents, to try to protect our kids, apart from obviously giving them the inoculation?
Yeah, I'm sorry about that. Yes, well, I mean, I think we've learned a lot about keeping ourselves and our kids safe and the value of hygiene, the value of actually not going to nursery or to school if you're sick, if you can be kept at home. All that does reduce infection. And then secondly, of course, I do want to stress about immunization. I know you said it, but a lot of folk have actually thought to themselves, well, with all this fuss and bother about COVID, perhaps we won't take our kids to be immunized. And anyway, it's quite difficult because doctors' surgeries have been using different working arrangements. So that is my main request to everybody. Please get your child vaccinated. Please talk to the local nurse or doctor about vaccination options. It really matters. It's so important. And with measles, the more people who get vaccinated, the more likely we are to get the whole measles outbreaks under control.
OK, and just before I let you go, what else are we concerned about as far as diseases, viruses that our kids might catch and spread?
Well, thank you. I mean, there have been reports of other conditions emerging, liver conditions and so on. And what I've noticed is that most of the worries are related to the fact that our health services and our lives have been so disrupted by COVID. So my basic point to everybody is, as things get going again, please get back into the rhythm of getting regular checkups for your child's health and for your own health, if that can work, because it really matters. That whole preventive healthcare is key to our collective future. And I'm just going to say, Kay, that COVID has not gone away. So I am going to ask everybody, keep a lookout for, if it comes back again, surging back into your communities, don't throw away those masks, get them out again and be ready to put them on, because COVID does have a habit of coming back, and masks and physical distancing are really important protectors.
Just before I let you go, we've only got 30 seconds left on the show, but it would be remiss of me not to ask about Otto.
Okay, my Otto is fabulous, up and walking well, and with his brother Isaac, he's just absolutely one of the bright boys of Burley near Aylesbury. What a village, and what a beautiful place. I hope they're having a sunny morning.
I'm sure he is the brightest little boy that anybody's ever seen in the whole wide world.
That's right, Kate.
It's good to talk to you as always, Doctor. Thank you so much for joining us on the programme. Thank you.
Bye-bye.